Hello, welcome to a presentation on working with neglect in Wolverhampton. This is a presentation that we did at some training, and we thought it would be really helpful if it was available on the Wolverhampton Safeguarding Together website. My name is Nikki Pettit, and I am an independent lead reviewer and safeguarding consultant. I completed a child safeguarding practice review recently in Wolverhampton, and they've asked me to share this information with you. Also here today are some members of the partnership. So what to expect? I'm going to talk to you about the learning from the case of child R, which is a local Wolverhampton child that I completed the case review on recently, and also make some reference to national learning and national reviews. We're also taking this opportunity to look at the Wolverhampton neglect strategy and the We Can Toolkit. So that's very relevant to professionals working in Wolverhampton. So why now? Well, the review for Child R, that's a child safeguarding practice review, was completed locally and is now published on the Wolverhampton Safeguarding website. We're also very aware of the fact that there's been wider national learning in the cases of Arthur and Star and other children that I've been involved in and that I'm aware of. This is also a good opportunity to look at the COVID impact on safeguarding work and on families where neglect's an issue. Also, we're aware of the fact that the neglect strategy and the We Can tool in Wolverhampton were launched in March 2020. Not good timing from the point of view of the fact that the country then went into its first major national lockdown due to coronavirus. So this was felt to be a really good point to relaunch that strategy and the We Can tool so that professionals in Wolverhampton are aware of it. So starting with the Child R Child Safeguarding Practice Review. So this is the review that I undertook alongside the Wolverhampton Safeguarding Partnership and with local professionals, including engaging with the professionals who were involved with the family and engaging with both the parents. So Child R was an 8-year-old baby who was found to have significant head injuries. The criteria was met for undertaking a child safeguarding practice review because it was recognised that there was learning for local professionals. Child R had a number of older siblings who were the subject of child protection plans for neglect prior to the pregnancy with Child R. Child R was then made subject to a child protection plan pre-birth. So when Child R was born, they were the subject of a child protection plan. The concerns in the family had been about neglect, but there had also been some injuries over time that were thought to be, at the time, they were thought to be due to lack of supervision and neglect. However, as you'll hear today, there is a potential that those were also non-accidental injuries. So in this case, the parents had significant vulnerabilities. Both of them had learning needs that those involved at the time were probably not aware of the severity of those learning needs. Both parents presented as more able than we now know them to be. They also both had low-level mental health issues, and there was known conflict in their relationships. I say there was known conflict rather than domestic abuse because at the time there was no evidence that of domestic abuse, but there was known to be arguing and there was known to be a lot of conflict. It's only since the injuries to Child R that the parents have given a lot more information, which shows that there was domestic abuse. However, looking back at the records, it's clear that the children had said things in school and had said things to other professionals that did indicate that domestic abuse was an issue earlier and that that was something that was potentially knowable for the professionals involved. So the learning, one of the things that that jumped out in this review and is something that is very, very regularly identified in quality assurance work and in safeguarding practice reviews is about the importance of all the professionals working with children and a family to know the parents' histories, to know what the vulnerabilities are, and to consider those when working with a family. It's always really interesting when you undertake a child safeguarding practice review and you identify what those vulnerabilities were. And some of those are identified immediately in assessments following the death or the injuries to a child or following a serious incident. But it's always really interesting going back and asking professionals what they knew at the time. And in this case, those involved with the family knew that the parents had some learning needs, but it was only in the care proceedings following the injuries that the extent of their learning difficulties were pinpointed and the impact that that was going to have on the children's parenting. And a lot of people in the learning event that we held in relation to this case, well, the practitioner reflective event, were really quite shocked when they heard about the assessments of the parents' capacity, which was learning needs, which was they're much more limited than people thought. And these parents had been able to come across as more able than they were. But things like juggling appointments, understanding their children's needs, understanding the impact of their behaviour on their children was something that these parents really did struggle with. The next piece of learning was about the need to understand a child's lived experience and what they may be communicating by their behaviour. A lot of professionals were involved with these children and a lot of people were going in and out of the house. And there was definitely a need for people to take a step back and think about what the child's experience was and focus on the children rather than the parents. And although the children were spoken to, there was also a need to think about what they were communicating by their behaviour, not just what they were willing to speak about. A couple of the children were preschool and too young to really be able to communicate verbally, but their behaviour was of concern. The older children who were in school could be quite guarded about what they said to professionals, which again is something that we see regularly, but their behaviour was quite extreme. And their inability to respond to clear instructions because they just weren't used to doing that at home again was very much of concern. What this case also showed us is the likelihood of neglect coexisting with other forms of abuse. And I have a slide coming up about why cases don't tend to be just neglect cases. We quite often hear in safeguarding work that it's just neglect. Obviously, neglect is very, very concerning in its own right, but also it often coexists with other forms of abuse, as we'll talk about. Also, the impact of growing families and growing children on the ability of parents to manage. This case was a really good example of that. We had a family with a number of older children, and they may have just been managing, but when a pregnancy and a new baby is thrown into the equation, it puts otherwise just about good enough care. It can really tip things over. And it's really important that professionals consider the impact of going into that family on a new baby, but also the impact of a new baby on the other children. What we also had, of course, was growing children. We had children of school age who were proving to be very challenging to the parents. And as their needs were changing, the parents were struggling to manage their changing needs. So it's really important that any work going on in a family like Child R's family considers the impact of new children in the family and the impact on the children's needs changing. I've got a separate slide on the cumulative impact on children of long-term neglect, because again, we felt this was a really good opportunity to provide information on the impact of cumulative neglect. That's care on the care of children over time where there's long-term neglect. So we'll talk about that some more. We also wanted to talk about Think Family and the need for professionals involved with adults to be aware of and involved in the plans for the children. So that's anyone from mental health professionals to those working in specialist domestic abuse services to substance misuse, housing, and the GPs for the adults. In this case, we found that the dad had a different GP to the mum and the children and had very little awareness of the fact that he was a dad or indeed that his children were on child protection plans. We also considered how COVID-19 affected the family and the services that they received. There's no doubt that that in child safeguarding practice reviews, we are going to be having to look at the impact of COVID-19, particularly that first year with the national lockdowns and the impact that that has on children. And I've got a further slide on that later. And then we also looked at the advice given for safe handling and coping with crying in this case, because the baby was born at a time when COVID-19 was having an impact on maternity services and hospital services. There were gaps in what was shared with the father in this case. But what we also learned was that just providing the normal safe handling and coping with crying advice isn't appropriate in cases where you've got parents with learning needs and low level mental health issues, which these parents had over time. And that advice, the icon or whatever other model of advice is being used, needs to be bespoke. I think bespoke's the key here, really. And with this family, it also needed to include the lower siblings, the older siblings. There were reports from professionals going into the family with the baby in its Moses basket and the other children throwing things that were like skimming over the top of the Moses basket. So needing to look at how that safe handling and that being around new babies advice to include the older siblings, we felt would be really positive. And then last but not least, following the injuries to this child, there were some gaps in the following of child protection procedures. So we've learned, identified learning about the need to make sure that those procedures are followed, particularly regarding parental contact following an injury. So when the injury was identified by a professional, she recommended that the family went to the hospital but didn't arrange for a professional to be with them. And then again, when they were first in the hospital, the parents were having unsupervised contact with child R, which again doesn't fit with procedures and was inappropriate in this case. So cumulative harm, we spoke about the impact of cumulative harm to children if they live in a family where there's long-term neglect. Some really helpful research which and this idea of cumulative risk and cumulative harm was identified in Australia in 2005. So what we're looking at is when the care of a child goes up and down over time, as shown in my hand-drawn diagram. If the line going straight across the centre is the threshold for neglect for child protection planning, for example, and the care of the child going up and down, up and down, up and down, and periods where things aren't so bad, which usually coincides with very sustained professional involvement with the family. And I think there might be a view from professionals that where the care goes up and down, the impact on the child goes up and down. When things are good, the child's fine. When things aren't good, the child isn't fine. But actually, what Broomfield and Higgins pointed out, and which we see every day in the work we do, is what we see is that when the care of a child goes up and down over time, the arrow across the centre that's heading in a downward direction shows us that the impact on a child over time is negative. And that's why we often see children in their teens who are really, really struggling with life. And that's because of the impact over time of the multiple episodes of abuse or those layers of neglect and all of the issues that have happened to that child over time. So one of the things that I mentioned earlier was whether there's such a thing as just a neglect case. And I think that thinking about the impact on children over time is really important. I think that thinking about the cumulative impact is important, but also thinking about the risk or occurrence of other types of abuse alongside neglect is something that we really need to do. As I mentioned in the case of the family with child R, there were some, we can see now with hindsight, that some of the injuries in the older children, though they were felt to be possibly or probably due to lack of supervision, could actually have indicated physical abuse. And so what we know is that actually in cases where there's been a serious case review or now a child safeguarding practice review, where a child has died or there's been a serious injury, it's actually neglect, not known physical abuse, that tends to be an issue within the family. It's been found that the coexistence of neglect is higher than 50% when there's a death or a serious injury. So I also think that physical harm can be missed in neglect cases. And I think that in the case of Child R, some people said to me in the learning event that the last thing they expected, the absolute last thing, was for this family to have such a serious head injury in the baby. They just didn't expect it at all. So Brandon et al., who do a lot of reflection and a lot of work on the learning that we get from case reviews, which is of course very rich learning, asked why the risk of physical harm can be missed in neglect cases. And one of them is optimism about engagement. And we definitely saw that in the case of Child R. We saw two parents who did engage with professionals on the whole. There were periods when they didn't, and there were periods where they were a bit avoidant, but on the whole, they did engage. And also there are efforts not to be judgmental. I think it's really important when you live in an area, in Wolverhampton, there are some pockets of very high deprivation, and it's really important that safeguarding professionals are not judgmental about that. But on the other hand, we also need to be open-minded to what we're seeing and to think about the risk or the occurrence of other types of abuse alongside neglect. And again, also key with Child R was the impact of increased family size being underestimated. Very much a case here with Child R. And indeed, again, with Child R, with injuries that are seen in neglect cases being accepted as accidental or caused by an older sibling. So again, important to really think about that. And also this mindset that it's only neglect. As we said, is it just a neglect case? And neglect can be seen as being unintentional child abuse. We've all worked with families where we know that the neglect is not intentional or they're doing their best, and so it's seen as passive and it doesn't really fit alongside a physical injury, physical abuse to a child. I also want to take this opportunity, because I've done a lot recently of child safeguarding practice reviews and audits where intrafamilial sexual abuse is alongside neglect. And although we know that sexual abuse can happen in any family, we also know that there's definitely a high coexistence when there is neglect in a family. And so professionals really do need to think the unthinkable and always have in your mind, could this neglect case, could there be other forms of abuse also happening here? So very briefly, I just want to pull out some of the learning from the national review that was published this year, with the learning from the deaths of Arthur and Star. And some of the things that they found, we also found in Child R, and certainly I've found in other reviews. And that national review was very, very clear that all of the issues they found are national issues. They're not just relevant in the two areas where Arthur and Star lived. So they talked about weaknesses in information sharing and seeking within and between agencies. And again, it's really, really important that information is shared, but also that those histories are shared, that what is known about the key adults in a child's life, that information is shared and is sought. There was also a lack of robust critical thinking and challenge between and within agencies, and the need for more and better strategy meetings. Again, I think that's something that I've seen nationally, and I've seen in a lot of reviews that I've either read or undertaken myself, is about taking the opportunities to get together and discuss what's going on and discuss that history in a strategy meeting is incredibly important. They also say that there's a need for sharper specialist child protection skills and expertise. And they talk very much about the complexity of this work, the complexity of undertaking risk assessments, the complexity of decision making. And they pick out a few key things that, again, we saw with Child R. And one of them is about engaging reluctant parents and being very aware of the things that reluctant parents might do to avoid professionals, about understanding the daily life of the children. I've seen some really, really good examples of how people understand that life, and understanding a child's 24-hour clock is really important. Understanding what that child's routines are, understanding where do they sleep, show me where they sleep, show me where they wash, show me, what's your routine with that child, understanding what their life is like, getting down on their level It's quite easy in very dirty houses to go in a professional and just look at what you see for eye level. But think about that baby that's crawling. Think about what they may see. Think about what their life is like when, there's lots and lots of rubbish on the floor. There's also a need to understand domestic abuse. Domestic abuse occurs in so many cases. In a very, very high percentage of cases where there's neglect, there is domestic abuse. And we know that that was also the case with the family of child R. Then we have the need to engage with and listen to children and the wider family. This was something that was really, really evident with Arthur and Star. And, what they're saying is that actually, find out who's around, find out if there are grandparents, aunties and uncles around. They're going to have a lot of information. I've just undertaken quite a high profile review where the family afterwards told the police and children's social care a lot of things that they were concerned about. They didn't share that at the time, but, maybe there are opportunities to speak to members of the wider family. One of the other things that came out of the reviews was about people having biases and assumptions that there may be malicious referrals, whereas what we know is that all referrals need to be considered on their merit, and we shouldn't assume that if someone is sharing information in bad faith, that actually it's not true. It might still be true and it needs to be looked at. Again, the impact of the parent's own history is really important. The risk posed by new partners who can often be invisible, and then the need for meaningful supervision and learning for professionals, which needs to be, constant. They also pointed out the impact of issues with capacity, recruitment and retention, including in children's social care, health visiting, and all those key services that we rely on to safeguard children, and the impact of COVID. And as I said, they're clear that these are all national issues. So, neglect in Wolverhampton. At the time that the neglect strategy was first launched in 2020, there was a very, very high percentage. There was, 70% of children who were on a child protection plan in Wolverhampton were there due to neglect. And we also know that there's a similar level today. So that's why it's so important that we get our work on neglect right. So it was decided that there needed to be a strategy and an assessment tool to use in Wolverhampton in those cases where neglect is of concern. And the plan was to provide focus and direction, so that's that strategy, to provide the tools to undertake effective assessments, which is the We Can tool, in the hope that that leads to improved outcomes for children and young people. And bearing in mind that diagram that I drew with the up and down care and the negative impact, it's incredibly important that we focus on neglect to improve outcomes. So this neglect strategy is Wolverhampton's agreed approach, and it's their way of saying we've identified that neglect's an issue and we need to do something about it, and we all need to do something about it. That includes people working in services with adults who are parents of children. It's framed within an awareness of the child and young person's rights and needs, including a need to respond early. One of the things that we know is the earlier that you help a family when neglect is occurring, the more likely you are to get a positive impact. But also an awareness that this is something that's likely to be an issue over time. This isn't a one-off. This is something that's going to be likely to be reoccurring over time. And then last but not least, there's a wish in Wolverhampton to measure the impact, to look at the impact of that getting in earlier and of improved services and improved identification over time. So in order to make that strategy operational, the We Can assessment tool has been developed and is now available. And it's something that it is expected that professionals commence when neglect is a factor. Included in that is a consultation with a child protect paediatrician. One of the things that doesn't always happen when I've done child safeguarding practice reviews and serious case reviews where neglect's an issue is quite often that the medical impact of neglect, the health impact on neglect is not always considered. So I thought that was a really positive thing that's in place in Wolverhampton. And it's also about management of neglect cases, which is about effective intervention, but also effective support for all staff working with neglect. And when we're looking at the issues that were there in the Child R case, you can see why it is something that professionals need support with. It's not easy. It's a very challenging and quite complex area of work. So if you're going to start the tool, then this is just a little bit about what you're going to be asked to consider. So you can complete the tool with the family. In fact, it's quite important to get the family's views and to include it with the family. But it's not just something that you complete with the family. You need to include your professional judgment in your analysis of what you know and what you found. One of the things we've had some really good feedback from on the pilot cases of the We Can tool is about groups of professionals who are working with a family completing it together. A midwife spoke to us when we did some training with staff, and she talked about getting together with a health visitor for the older children and the schools, the primary school teachers, getting together with the family support workers who knew the family, and actually all putting the information that they've got together and completing that together, and how important that was in looking at whether neglect was an issue for that family. It was for that family, but also being really, really clear about where their concerns were. And that was something that they then submitted when they made a referral, or where they did a MARF into the front door in children's social care. It was incredibly helpful information that could then be built on. I think what it's really important to know is that the result of the We Can tool is a starting point. It's not a one-off. You know, as I said before, neglect isn't something that comes and goes, that is there and then it's gone. It tends to be something that needs impact. It needs intervention over time. So it's really important that you consider that. It can be used for all children, including those with special needs. There's been a lot of work done to ensure that the tool is appropriate for all children. And also each sibling needs their own specific assessment. It's really important because children at different ages will have different needs. Children with different personalities will have different needs. There might be children within the family who are stepchildren to one of the parents. That will bring a different dynamic. There can also be children with special needs, of course, lots and lots of examples. So as I said before, that using the tool will involve you using your professional judgment, your analysis of what is found. We think it's really, really helpful, but you still need to think about, what do I think? What's my gut feeling? What do I believe that these children's life experiences, you know, with all of this going on? So the tool itself looks at child indicators. It looks at carer and parent indicators and context indicators. So there are 3 sections that you will fill out that should give you a really wide ranging view of what the issues are and where the risks are. Also, it's important to say that the tool is for all ages of children, because neglect not only impacts young children. There's been a number of case reviews of the impact of neglect on young teenagers and older children. Having looked at the tool in order to do this piece of work, I did feel that it does need a little bit more work to make it inclusive for older children, and I fed that back to the partnership. So there might be some more changes, but certainly there's enough in there to make a really good start. Also, we're asking professionals who work with adults to think family and to think about whether or not the parents' vulnerabilities create a risk of neglect to the children. And also, very helpfully, the tool includes references to research and to things like case reviews, which will be very helpful for you. So we're nearly finished. The impact of COVID-19. I think it's really important that we just have a quick look at this, because we all know that COVID-19, and particularly those periods of national lockdown, created a lot of parental and carer stress. You can see in the case of Child R that did have a significant impact. This was a family living in a very small accommodation. And also they had some bereavements in their wider family due to COVID. So it was a very, very difficult time for the family. And we know that also the children's vulnerabilities were exacerbated by the impact of COVID-19, not being able to go out, not necessarily seeing friends and wider family members. and actually those systems that we know protect children, including schools. And those periods of national lockdown when schools were closed except for vulnerable children, what we do know is that large numbers of vulnerable children who could have gone to school during that period didn't. Parents couldn't be forced. It was up to the parents to decide. And we know that the siblings of child R didn't go to school during that time, despite the fact that the school tried very hard to encourage the parents for the older children to come to school. And then last but not least, of course, the surge that followed in lots of services, for example, in health services, and concerns that when children went back to school of things that had happened, the surge in demand for mental health services, both adult and children, for example. So the impact of poverty, one of the things that we spoke about with Wolverhampton was about the fact that poverty and the cost of living crisis that we currently have can have an impact on neglect. And there is indeed evidence that links poverty to child abuse and neglect. Really recent helpful report from the Joseph Rowntree Foundation said that changes in income alone, even if you hold all other factors constant, does have an impact on the numbers of children being subjected to neglect and abuse. And improvements in income then reduce these figures. So it's important to know that. And it's important to know that we need to take account of the socio-economic circumstances that are affecting families. And the Joseph Rowntree Foundation say that children's services, and that's all services that provide services to children, not just children's social care, don't take account enough of those socio-economic circumstances. And also that professionals can become desensitized to the impact of poverty. And again, it's really important that poverty is thought about. However, I think we also need to be clear that that is one of the things that needs to be considered, but that's not the only thing, and that actually this is really complex work. And so all issues need to be considered thoroughly, including, but not just, the impact of poverty on the child and on the parenting. So it's something we need to think about in a better way than we have done, but it's not the only answer. It's not the reason for neglect. There are families where poverty is an issue and neglect isn't. So again, it's just something else that we need to consider when we're talking about neglect. So finally, I wanted to take this opportunity just to go through what the National Child Safeguarding Practice Review Panel said in their report. So this was the last time they published a report about the key practice themes that come out of the hundreds of child safeguarding practice reviews that are completed every year. And there were 6 key practice themes. We are expecting another panel report. They come out annually, but this was something that may have been lost to you in the stresses over the last year. So again, repeating some of what we found in the Child R case and some of what has been found in those national reviews. So needing to understand what the day's life is like for the child, needing to understand their lived experience, needing to make sure that everybody takes responsibility for that. And then professionals needing support, particularly when engagement is reluctant or sporadic. Those cases that have professionals scratching their heads about how they're going to engage a family, how they're going to get a foot over the door, how they're going to get that family engaged with the services that are being provided. Critical thinking and challenge, again, the need for really, really good challenge across agencies and within agencies. You know, the role of chairs of strategy meetings and child protection conferences needing to provide that challenge. Professionals using escalation policies where there's a disagreement is so important. And then the need to respond to changing need and risk, which was very much something that we've spoken about in respect of Child R. And then we've got sharing information in a timely and appropriate way. Again, sharing what's happening now and what your concerns are now, but also making sure that everybody working with the family has got that important historic information. I'm doing a review at the moment in another place in the West Midlands. And in that review, we found that the schools that the children were going to didn't know that the children had been on a child protection plan when they were younger, because the child protection plan had been closed before they started school. And that information wasn't shared by those who did know. They were just getting universal services at the time that the children started school. But unfortunately, what had happened to them previously was something that's likely to reoccur. Lots of the adult vulnerabilities that create risk to children in regard to mental health, in regard to domestic abuse, tend to be things that reoccur. So it's really important that not just what's happening now, but what's happened in the past is shared with professionals. And then last but not least, the need to share learning, because organizational leadership and culture can create good outcomes. And that's something that the neglect strategy in Wolverhampton is really hoping will happen, and the reason that I've been asked to talk to you today. So thank you. If you have any questions about what's been discussed today, please contact the Wolverhampton Safeguarding Together Partnership. Please take the opportunity to read the Child R review if you've got time. And I know that this is going to be available with other bits of information, including the strategy and the We Can toolkit. So good luck, everybody, and thank you.